and you think about different ways that we as a people were used as guinea pigs, there's this stigma that's been built around what it means for us to be treated by physicians, what it means for us to be treated at a hospital. And so, for me, thinking about how Jared mentioned being able to connect and relate, understanding that there is a certain way that I can speak to said grandmother, said uncle, said cousin, to connect with them, to help them understand that in some cases, this is a matter of life and death.
Dr. Gary Johnson is a native of Mobile, Alabama. He's a graduate of Murphy High School. Dr. Johnson attended the University of South Alabama from 2006 to 2009. While at USA, Dr. Johnson was initiated at the AIDA chapter of the University of South Alabama. Dr. Johnson also attended Spring Hill College from 2009 to 2011. Dr. Johnson earned his MSN in Executive Healthcare Administration from Middle Tennessee State University. Dr. Johnson later went on to earn his doctorate at Executive Healthcare Administration and Nursing Systems at the University of Tennessee at Chattanooga. Dr. Johnson is an alum of the Mobile Alumni Chapter of Kappa Alpha Psi's Garrod Kappa League program. Dr. Johnson was an active member of the Mobile Kappa League step team. At this time, I will ask Mr. Jackson and Dr. Johnson a series of questions. Towards the end of this presentation, we will open the floor for questions. You may place your questions in the chat. All right, on to our first question. And you know we always have to start off with the Kappa League questions. Why did you choose to join your Kappa League chapters? Mr. Jared, you were part of the Hattiesburg Kappa League, and Dr. Johnson, you were part of the Mobile Kappa League.
Yeah, so my whole, reason for joining the Hattiesburg Kappa League at the time, I had a lot of my friends and close friends, what I almost consider family, to join the Kappa League previously and before me. So just being around them and hanging out with those guys made me want to be a part of it. Also, hanging out with them and being close to the Garrod Kappa League at the time, I was able to see Carl and a couple of the other mentors and how they handled themselves, how they handled things, not only just at parties, but also going to seminars similar to this. I'm an old head, so we didn't have Zoom at the time. We would actually have to physically go to a seminar or show up to an event. So, seeing those guys and being close to my friends that were already a part of Kappa League just made me want to join Kappa League at the time.
So that was Mobile Kappa League for me. I know Jared was in the Hattiesburg Kappa League, but similar experience. When I attended Murphy High School, I was there as a freshman, and I saw the organized group of young men that really spoke to education, spoke to their ability to connect with other individuals. The example was something that I really wanted to be a part of. At that point in time, looking at what was available to us, the city really respected the Mobile Kappa League. So when I thought about what I wanted to be a part of, what I wanted to do beyond sports, beyond band or ROTC, the Kappa League really spoke to me. Beyond that, I saw those individuals graduate. I saw those individuals show up in spaces. They were leaders on campus, and it was a group that I felt like I could learn from and also be an example from.
Thank you for your response. All right, on to our next question. Mr. Jackson, why did you choose your field, nursing?
It chose me is what I would say. I don't think that I necessarily chose it. It kind of just fell in my lap. Leaving high school, leaving Hattiesburg, I knew I wanted to do healthcare. My major at the time when I attended LSU was biology, pre-med, was taking those courses. And at the same time, I was also having a little bit too much fun. Kind of got behind in the schooling, but also at the same time during Christmas and summer break, I would work back home at the hospital there, Forest General. A family friend of ours was the chief trauma surgeon at the hospital, and she said that if you want to get into medicine, you want to, be around bone and guts and blood at the same time, you might want to see if you can handle it first. So I would work in the OR every Christmas and every summer break. And at the time, I was able to see a lot of things. I was able to hold the heart during heart surgeries, participate in a lot of orthopedic cases at the time. And I was able to meet a lot of people in, so to speak, network. One day after work, I was hanging out with a guy, and he was just asking me about school and telling me things, and he was saying that I could do what he does. And the whole time I thought he was an anesthesiologist. So he told me, no, I do nurse anesthesia. I went to nursing school first, and then I went back to anesthesia school. So once he told me that, it clicked. At that moment, he wrote down, I think we were maybe at a happy hour or some sort of work event. He wrote down on a napkin everything that I needed to do step by step in order for me to, become a nurse anesthetist. So I went home that night, told my mom about it, changed my major. And from then I started on the nursing track. So like I said, I didn't necessarily choose nursing. It kind of just fell in my lap and it chose me.
Dr. Johnson, same question here. Why did you choose your field?
Yes, sir. It's eerily similar to Jared, except for my mother's a respiratory therapist at Women's and Children's Hospital there in USA, Mobile. And so I grew up around the hospital. I spent a lot of time on the pediatric ICU floor and walking those halls, being her son. I have family members that have become nurses, some that have become physicians. And so medicine was always around me. One of the things for me is that my mother always knew what to do. She always knew how to address any ailments I had, any sickness. She was the go-to person within our family. So I wanted to be sure that as the man for my family, the man for my house, that I was able to do the same and also make a good living. So going through high school, at Murphy High School, I was a part of the RTC program there in Kappa League, of course, and there was a lot of focus on preparation, getting yourself into a space where you understood what your journey was going to be post high school. At that period of time, I wanted to be a pediatrician, and I knew that in order to go to school, I had to get a 4-year degree. 4-year degrees, like Jared mentioned, on biology or math or another science, but say something happens once you graduate with that degree and you can't go directly to medical school. This is what was playing in my mind. I was a bit over-prepared. I wanted to be sure I had something that could take care of me if I needed to pause at that space, and or if something happened in my family and I needed to take care of my family without being able to go back. I had a way to do that and do that at a very exceptional level. And so similar to what Jared mentioned in terms of getting that exposure, getting into the space to understand what it feels like, what it smells like, and being in those settings or environments, nursing was the call. And so I knew then in high school, I was a junior in high school. I said, well, I'm going to go to school. I'm going to get my bachelor's in nursing. I'm going to feel myself through what it looks and feels like to be in those hospitals, be in those settings as the owner at that point in time. And if time permits, if everything lines up, then I'll go to medical school. But from there, when I started my nursing career, it blossomed into something completely off my radar. And in leadership and in spaces where I really was able to find my purpose in delivering that space.
How does increasing the number of Black male nurses and healthcare professionals impact patients' trust and health outcomes in undeserved communities?
Okay. Yeah, it's basically what I just said. Patients seeing someone that looks like them will automatically make them feel a little more comfortable and at ease about what's about to happen. I can't speak completely across the board, but I can, speak to my situations dealing with patients that are going for surgery, or when I worked in the ICU, having to speak to families about certain situations that are going on. And to hit on that, a lot of times it's the family, not so much as the patient, that you also need to relate to. Being able to tell, the aunt, how our families are. Everybody want to know everything. Aunt, cousin, uncle, mom, grandma, everybody want to know what's going on, how they can help, or what needs to be done. So understanding that, the Black family dynamic is a lot different. So we need to be able to, treat each and every member of that family as if they are the main caregiver of that patient. understanding that we can be relatable. They see a black face, you get it all the time. I see a black face. Oh, it's my first time ever, having anesthesia done by somebody that's black. So increasing the numbers of black people providing anesthesia or in healthcare period can help to, alleviate that weariness that a lot of patients have in dealing with people of another color or another race, putting them to sleep or providing healthcare for them. So, increasing those numbers and just having more of a black representation in healthcare definitely helps with that.
Why is representation in healthcare important for young black boys who may be considering their future careers? Dr. Johnson?
Well, I'll start by answering the question this way. We need representation. Part of the reason being is that when you go to your local hospital, you're going to see a lot of people that look like you and I. When you go to different communities, every community needs support, needs healthcare, needs access to care. Looking at the representation, going through school, I was almost always one of one. What I mean by that, I was either the only male and especially the only black male within those spaces. That didn't change as I matriculated through college and got into the workforce and the work setting in the hospitals and outpatient settings. I was normally one of one. It's a unique space to be in. For me, fortunately, I had a foundation that really didn't shake in the midst of being the only one that looked like me, that understood my experiences. But it put me in a position to where I could pull others into that space when they decided to be brave and enter into that space. Stepping into this space and becoming a leader, it put me in a position to where I could really steward the gift of access. It started off with access to care and being able to have those that look like us, whether it's us being males or our mother, auntie, cousin, sister, whomever it may be. I was able to stand in the gap and connect the dots for them. The last point that I'll make as far as representation, health literacy. And what I mean by that in simple terms is you being able to understand what it means to have something going on with your body, what it means to go to a physician and the physician tells you that you have to do X, Y, Z. Or if there's a insurance prior authorization, things of those nature that put you in a position to where it's your first time hearing those words. It's your first time trying to understand what it means to do something different that doesn't come natural to your body. It puts us at a disadvantage when we aren't represented, when we don't understand it. And for me, again, going back to purpose, it really put me in a place to where I could connect the dots for those that were less fortunate to have the same exposure.
Why is representation in healthcare important for young black boys who may be considering their future careers?
Yeah, I'll just kind of piggyback off what Gary is saying. It's really about representation. Interact with patients all the time, and especially in the older, the geriatric community, you get a lot of them who essentially have a wall up, towards doctors and most surgeons that are, white or not black. And once they see a familiar face, it's almost like they let their guard down and really can establish a good rapport with them, especially in my line of work and putting somebody to sleep. You want them to be able to trust you, with their life essentially. So establishing that good rapport and just getting a good communication with that patient and them seeing somebody that looks like them, that can relate to the ins and outs of their daily things, even small things like, you might get your grandmother there with a wig on. She don't want to take a wig off. A lot of white people wouldn't understand the reason why she don't want to take a wig off. Or she's got, braids in her hair, something to that effect. They wouldn't understand it. But for me, I'm able to understand why your grandmother wants to keep her wig on throughout the surgery and she don't want to put a particular hat on that'll mess her wig up. I'm able to understand that because I got the same, my grandmother's the same way. She were to go to surgery, she wouldn't want to take her wig off. It's about presentation and about looking a particular way regardless of what's going on. So I'm able to empathize with them and I'm able to almost go to bat and fight for them to be able to keep their wig on, to be able to do certain things that a person that's not black wouldn't be able to understand. So just coming from my perspective, and like I say, also piggyback off what Garrod was saying, it's really about representation, and having that representation can help you be an advocate for patients of color. In my line of work in nursing and healthcare across the board, it's about being an advocate for that patient. And if you can understand and empathize and relate with that patient, you become that much more of an advocate, and that the patient population will trust you a lot more. So seeing a familiar face or being able to relate, like I said, with the simple things of the grandmother having a wig on and not wanting to take it off. Those are just things that being Black, essentially, male or female, you can relate to patients and they can relate to you.
How does increasing the number of Black male nurses and healthcare professionals impact patients' trust and health outcomes in underserved communities?
Similar to what Jared mentioned, I'm going to take a different approach. Fear and vulnerability. We historically, as a people, have certain stigmas around going to the hospital, going to the doctor, taking medicine, and for good reason. When you think about the Tuskegee experiment, and you think about different ways that we as a people were used as guinea pigs, there's this stigma that's been built around what it means for us to be treated by physicians, what it means for us to be treated at a hospital. And so for me, thinking about how Jared mentioned, being able to connect and relate, understanding that there is a certain way that I can speak to said grandmother, said uncle, said cousin, to connect with them, to help them understand that in some cases, this is a matter of life and death. In some cases, this could be a situation to where you choose out of a state of unknowing, and you choose to shorten your lifespan. You choose to ignore something that could really help you. And to Jared's point about being an advocate, which is being somebody that speaks for somebody else, being somebody that stands in the gap and helps soften the blow if it's a case where there's unfortunate information you have to share. Or it's a way for you to help somebody understand that there is hope and there's a way to get beyond your current situation. And so in those underserved spaces and communities, having someone that's knowledgeable, that's empathetic, and has an ability to connect with the community will certainly support that community. Last thing I'll mention is that in those communities, you often have food shortages. You often have situations where the only meals your children receive are at school. You have situations where either they're on the lowest form of insurance coverages you can possibly find. And so access to certain medications, access to certain tests, things of that nature, they don't have readily available. So whenever you are able to see them, whenever you are able to communicate with them and connect with them, you're able to share and enlighten them, give them information that they otherwise would not have access to. And we talk about being in these communities, and that question is very, very poignant, because in those communities, we normally go to the same churches. We're at the same parks. We're at the same grocery store, wherever it may be. And so when you run into people that you see that potentially is a patient, or run into people that you see that are suffering with a certain issue, having strong Black men or sound Black men, confident Black men, they're able to step into that gap and share, impart knowledge, and be able to support those that would otherwise have adverse outcomes.
What role do mentorship, community outreach, and early exposure play in encouraging Black males to pursue careers in nursing and healthcare?
For sure, it's really one word: exposure. Being exposed to different ways of life, different living, whether that's traveling and just realizing that there's more to the world than what's going on in your particular area. I think Garrod Kappa League is definitely a major factor in that. I'm sure Carl continues to take you guys on, college tours and taking you to different towns and cities for step shows. You being able to see more than what's actually going on in Mobile. So exposure is the big thing. Like I said, I would have never known about being a CRNA or nurse anesthesia if I had not met this guy from Forest General named Greg, who was a CRNA. The whole time I thought he was just an anesthesiologist. So me being exposed to that and being in that circle and network of people helped me to elevate and find my career path. And that's, the main reason why I'm here today. So my biggest thing, would be exposure, seeing more, experiencing more, trying new things, visiting different places you never thought that you would visit, man. One of my biggest things is traveling. It's a couple of guys in the chat that, I've been friends with since Hattiesburg Kappa League, and we travel often together. Every year for my birthday, we go somewhere. So exposure and seeing different things is big there. If you ever get the opportunity to, I guess, do some sort of medical mission, that's another thing. I go to Guatemala every other year and do a medical mission. We go down there and serve the underprivileged, doing surgeries for people that have been waiting for a surgery for almost 4 to 5 years now. So exposure, experience, seeing new things, getting outside of your bubble of friends or outside of your bubble of family is I think the biggest takeaway from that whole question there. That would be my answer: exposure and experiences.
What role do mentorship, community outreach, and early exposure play in encouraging Black males to pursue careers in nursing and healthcare? Dr. Johnson?
First thing comes to my mind is that it's possible. It is possible. Jared mentioned that sometimes we'll have patients come into our facilities when I was bedside, and certainly where I am today. When they see me, you can tell that there's a light switch that comes on. Whether it's a very proud moment or it's somebody saying, I want you to talk to my nephew. I want you to talk to my niece, my daughter. To see somebody that looks like you in this space, in this role, gives belief, gives hope. You find a lot of individuals in our community that are just proud to see those like myself and Jared that have been able to matriculate or make it to a certain level, and be confident. Black men, be proud to be Black or unashamed to be Black. It certainly makes a difference, because I can tell you one thing, but when you look at me, I'm showing you another thing. And so, Jared, I'm sure remembers this, but I think about this all the time. I'm forever indebted to him, and I'm going to use this as an example. Jared is my senior, and a few years my senior. And as I was going through nursing school, he was one of those individuals that I spoke to, I consulted with, and he coached and supported me. And there's a period in nursing school when you get towards the end, you have to have a certain number of real time hours or experience. They call it the practicum. And I was able to connect with Jared, me being his mentee and being my mentor, to put me in a space to where I could get that completed. I could feel comfortable in that space. And one thing that I've mentioned to Jared, but it was a while ago, his name carried so much weight. So having a mentor and having somebody with, as people would call it, a good face card, his reputation was solid. And so for him to, allow me to attach myself to him, supported me in ways that I've yet to be able to articulate. So when you talk about community, you talk about mentorship, it starts with those relationships, connecting with someone that's doing the thing that you want to do, connecting with people that you see are successful at what it is that you want to do. And so it makes all the difference. Who knows where I may have been without having that opportunity that Jared afforded me and being my preceptor in that space. So just using that as a real world example for me and the two individuals you have in this conversation, it means a lot. Last thing I'll mention is I talked about access. What Jared did was provide access for me. And sometimes that's the difference between you being successful, you being a CEO, you being whatever your wildest dreams can think of. Access makes the difference. And so that's what I would leave you with in terms of being able to answer that question when that community mentorship space access.
But at this time, are there any questions from the chat?
Can we talk about curriculum? So what courses did you all take to prepare you to get into nursing school? How was that bio and anatomy and so forth?
It's a lot of math and science. Survey of inorganic and organic chemistry, biology 1 and 2, A&P 1 and 2, statistics, calculus, which, I took calculus at Murphy. So the the curriculum was rigorous and purposefully so. Nursing school is not easy, but I'll share this. When you get into a space to where you can get into nursing school, when you go through all of that rigor and you get into the space to where you're fighting through to graduate, nursing is something that can take care of you for the rest of your life. It can expose you into so many different avenues that you either have never heard of or thought were never possible. So the curriculum is certainly rigorous, but it is well worth it. So well worth it.
Good. We have a question from Dr. Jason Ford Green.
I appreciate you, brothers, man. Y'all are definitely setting a shining example for STEM practitioners and just folks from Southern Alabama. So we really appreciate y'all. And y'all did the right thing. You mentioned FAMU several times in y'all's in y'all's feedback. Now, as Carl knows, I pledged Alpha Z at FAMU in spring 2004, Disciple Building Legacy of Chaos. So number 12. So we had a big line. And so, but I came through those ranks of biology at FAMU and then went to Jackson State. So I'm a JSU Tiger for chemistry, did my master's and a PhD in chemistry. I was blessed because I had a mentor, and my mentor at FAMU, he looked like me. He was a black guy from Baltimore, and he knew quantum chemistry, and he cussed like a football coach at the same time. And that resonated with me. So it got me in the gear. It got me engaged and hooked, and I ended up finding out that I was a chemist and a biologist. So I wanted to thank you, brothers, for your feedback, but also ask you for some feedback on what is your quality of life like? Can y'all share that with everybody on the call? Like, what's in your daily walk? What does a day look like for you?
I guess I'll lead it off. A typical day for me is doing surgery. Surgery is typically starting anywhere from 6:30 to 7 o'clock in the morning. So I'm usually up and rolling about 5:30. Get to the hospital, get everything situated, get your room set up, go see your patient. And you might roll back at 7:30, sometimes 8 in the morning with your first case. I don't particularly, I'm kind of across the board. I do a little bit of everything. In anesthesia, you kind of become a jack of all trades. I do pediatrics, I do hearts, I do a little bit of everything. So my day may start out with some orthopedic cases, and at lunchtime I may be doing some tonsils on a 7-year-old, or cutting off a foot or something like that. So my day kind of varies. The one thing I will say about just working in surgery or in anesthesia period is that each day is different. Yeah, my quality of life is pretty good, man. I work a 40-hour week, sometimes 50. I'm usually out of there about 5:30, 6 o'clock every day. So, a good quality of life, man. Make a good living for myself. So I really wouldn't change it for the world at this point.
The quality of life piece is pretty incredible. Right now, as an executive in healthcare, I oversee 80 plus facilities. I have programs in about 15 hospitals. I touch about 3 different states. So I spend a lot of time connecting with individuals. So I'm on the go. I'm normally up still around 5 or 5:30. When I was working in the ICUs and the dialysis units on the outpatient side, I was up probably around 3:30. But those mornings started really early, but they ended early in the afternoon as well. So to that point, like I said, in my current role, I spend a lot of time picking where I need to go and deciding how I'm going to schedule my day, ensuring that I'm meeting the needs of the business, but also spending the time that I can with those individuals that are supporting the business. And, similar to Jared, I don't work any weekends. I get to travel quite a bit. And it's because of what we've been able to build, so that matriculation really set up that quality of life to not only have a good quality of life, but to be able to sustain that quality of life. So I think that's a great question.